hip extended, stall prone hip flexor stretch. Now this is a way to add additional range of motion or stimulus or intensity to the basic stall prone hip flexor stretch. Now you can use a foam pad, you could use some type of padded bolster, you can use a long roller, you can use a short roller. It doesn't really matter other than the range of motion. You wouldn't want to, this is about the biggest that you'd want to go, a regular size diameter roller. So we would start with like something that's padded so it's not as much range of motion. Same exact position as the stall prone hip flexor stretch. Nothing changes there. Halfway on the table, halfway off, go to a slight hamstring stretch. All those things the same as stall prone hip flexor stretch. But in the hip extended, what we're going to do is we're going to lift up the client's thigh. This is not something that you'd start with. This is a stretch modality that you would add, of course, after the client has sufficient range of motion to start adding a little more degrees of range of motion into hip extension. So make sure the leg is firmly supported by the padded structure there, which is also going to help you kind of decrease the amount of pressure you're having to apply to keep the hip in that position. Now this would be also the starting position for increasing the range of motion there. As you shift that pad closer towards the hip, it's going to increase the range of motion into hip extension. So the closer the pad goes towards the hip, the more the degrees, the greater the stretch. The further away from the hip, the lesser the degrees, the lesser the added stretch from the hip extended bolster. From there, go ahead and stay relaxed. Always make sure the client stays relaxed. Place the hand in the upper quadrant. Make sure pelvis stays towards posterior tilting. And then just apply slightly additional stretch. You can also use the shoulder here to just gently add a little additional knee flexion. Now make sure anytime you really start getting in range of knee flexion, always, or in placing any types of stress on the knee during applied modalities, always good to ask the client, is your knee comfortable? Do you feel okay in the knee? And if they don't, you're going to need to adjust your technique, back off pressure, focus more on the hip. If they don't, you can continue applying a safe stretch and never past a 6.5.